Like and subscribe right now, or else this will be in your bed tonight. r/AskReddit by Planet Reddit. Doctors of Reddit. Who has been your worst? But I looked it up on WebMD patient. I'm not a doctor, but I did take my very elderly nana to the hospital after I showed up to her house and found her slurring her words and behaving very strange overall. Now, my nana is a major hypochondriac, and when she was admitted, the first thing she told the doctor is that she believed she was experiencing the beginning signs of Parkinson's. It turned out that she had mixed up a bottle of non-alcoholic wine with a bottle of regular wine, had drank the entire bottle, and was completely hammered. Honestly though, the sensation of being drunk would be so disconcerting if you weren't expecting it. Yeah. The symptoms of being drunk are similar to the symptoms of being roofied. That's why people in bars usually don't notice if someone slipped something into their drink until it's too late. It's super freaky. Serious answer. I try to ask my patients if they have googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about their findings, and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says, "I think I have caught the Down syndrome." Or when a young woman thought she had testicular cancer. I actually had pretty advanced serum sickness from strep penicillin, and the nurses told me I was not having any problems. The doc in the ER said he didn't know what it was but looked it up himself and said, "Yup, you do have serum sickness." It felt nice to be listened to. This was pre-WebMD. But I used to have issues with a racing heart. Everyone called it anxiety, but I insisted it wasn't. No one listened. Shitastically crazy, no one thought to take 10 minutes to dig out and hook me up to an EKG machine. Anyway, in high school I started to pop stackers to lose weight, and high doses of caffeine plus a misdiagnosed heart condition equals a huge told you so moment. Short of it is I had WPW syndrome. Quick in and out fix. And I will forever hold that over my family's head. I will also never back down on a health issue again in my life. Edit. Don't do drugs. Kids. I was 14-15 at the time, and my parents were the ones buying the stackers for me, so my beef for not being the smartest person in the room. This will make my friend sound stupid. And she really isn't. When she had her first baby and was in that woozy sleepless new mom phase, she took the baby for her checkup and completely misheard when the doctor told her the baby had eczema. She got home and started googling what she thought he had said, and called me in a panic, saying, "The doctor said the baby has emphysema." Why? That infant never smoked a day in her life. Full stop. This reminds me of when I was getting married and my husband and I were looking for a hotel to stay at on our wedding night. He called me and said he found one that had a honeymoon suite, and included in the package was strawberries and shampoo. We still laugh. Almost 30 years later, at the thought of toasting our new marriage with shampoo and not champagne. To be fair, most brides have an awful time with their post-wedding hair because it's often been curled, arranged with numerous pins, then sprayed all over with clouds of hairspray to keep it all in place. Full stop. So perhaps shampoo in a honeymoon suite isn't the worst idea. Seems like I had to wash my helmet hair at least 2-3 times to get all that out. The other day I had a guy come into the ED and says because he had wrist pain, and the nurse at his work's occupational health looked it up and told him he has multiple sclerosis. I love good nurses, but there's areas that they are not trained in. We did an appendectomy on a patient who was like maybe 4 weeks pregnant. After the surgery, the nurse called me saying she couldn't hear the fetus's heart anymore, after telling the patient that maybe she had a miscarriage during the surgery. Turns out the nurse used a Doppler pre-op and mistook the iliac artery for the fetal heart rate, and then couldn't find the artery post-op. Several levels of WTF in that one. Edit. You cannot hear a fetal heart at 4 weeks with anything. Ever. Jesus Christ. Surely the nurse shouldn't be allowed to be the one to break that news without consulting the doctor, even if that was what happened. In this day and age of the internet, I'm still surprised people don't use WebMD more. Just this week I was in our workroom when a senior physician sitting next to me was on the phone and suddenly grabbed my arm while desperately trying to keep a straight face. The senior physician was talking to a 24-year-old female patient and the conversation was going, "No mom. You can absolutely get pregnant even if you don't orgasm. No mom. Just because he's feeling nauseated the morning after doesn't mean you're pregnant. I mean the WebMD page on this is pretty darn good. Just because he's feeling nauseated the morning after. WTF. Why do you think couples say we're pregnant and not she's pregnant? RN. But my favorite was when a patient's family member rudely insisted we give her mother who had a major stroke, resulting in nearly zero swallowing capability, as much water as she could drink because I read a study online that said you can't aspirate on water because your lungs just absorb it back into your bloodstream. I looked her dead in the eyes and said okay. Then explained drowning to me. Oh gosh. Save us from the daughters that read stuff online. I did home health care and took care of a lovely lady in her 90s. She had very bad diabetes. And even though she was constantly monitored and checking in with her doc multiple times a week, it still was not unusual for her to run between 250 and 300 after dinner. A carefully measured and balanced dinner. It freaked me out every time I saw it. Anyway, her daughter kept telling me about this juice cleanse she heard about. I kept telling her that it was a really bad idea. But she kept bringing it up because her chiropractor talked about it all the time. I went on vacation for a week. Came back and my lady is gone. Hospitalized. You guessed it. As soon as I was out the door her daughter started the juice cleanse. She was going to prove me wrong. Amazingly, this little tiny 97-year-old lady managed to do well enough for 3 days. 3 days until the evening nurse clocked her blood sugar at over 700. The EMTs couldn't believe it. She was groggy and nauseated, but still conscious and her sweet self. She was in the hospital for over 2 weeks because they just couldn't get her sugars to balance. She came home, but had even more problems than before. Her daughter wouldn't even look at me. She nearly killed her mom to prove herself right. The icing on the cake. A week after she went home, she gets admitted to the ICU for, you guessed it, aspiration pneumonia caused by the daughter trying to feed her solid foods. I had a woman come to see me because of abdominal pain. I spent a good 10-15 minutes of asking her questions to get a better understanding of what could be happening. I ended up ordering an ultrasound to assess for an ovarian cysts and some blood work. As she's leaving she goes, "Are you doing lab work for my prostate?" I had to bite my tongue so as not to laugh and said no. Because you're not a male and you don't have one. She just said oh. And left. Spoiler alert, she had an ovarian cyst. Edit, there you grammar Nazis. Happy? Quotations FTW. Our family doctor once asked my husband if he was pregnant as she went down a checklist. They had a good laugh. I once told a woman she didn't have a prostate when asking about the result of an ultrasound, and she was just appalled. I blame myself for a string of miscommunication that was like, "Lady, so dear, how is my ultrasound?" Me, writing down the report on the note. Totally distracted. "Oh, it is fine. Normal, lady. So everything is normal. Even my prostate?" Me, again super distracted. "Oh. Yes. You don't have a prostate, lady." Freak out. "What? Why? Is that the reason for my pain?" Me. "No. You just never had one, lady." "What? WTF? It can't be me. Believe me, you've never had one, lady." "Oh really? Then how am I still alive if I do not have one?" Me, now full attention on this, trying not to laugh. "Excuse me, ma'am. That is an all-male organ. You don't need one to live. It produces fluid for the sperm, lady." "Oh." Librarian here. Before WebMDDR, Google is a medical textbook called the Merck Manual. While intended for medical student doctors, it quickly fell into the hands of decades of self-diagnosers. I once heard it described as hypochondriac's handbook since 1899. Still being published in print and available for free at merckmanuals.com link. Sad and long story, but to keep it very brief. Lady on 4 vasopressors including high-dose epinephrine. Was gonna die in the next few hours. Husband was convinced that epinephrine was causing the low blood pressure and low heart rate. He kept going back and forth from home to the hospital with online printouts despite myself, my fellow, and my attending, and the nurses all telling him that this medication is keeping her alive. We looked at his first printout. It said, ephedrine. We're like, first of all, that's not the same medication. Anyways, I actually tell him that if I was him, I'd stay with her and that she may only have minutes left. He's threatening to sue us and he's convinced he's right. He goes home again to get a new printout, and she ends up dying while he's at home. This poor man probably couldn't handle the grief and trauma of this situation. Not a doctor, but when I was in middle school the internet led me to believe that it burned when I peed because I, who had not so much as held a girl's hand, had syphilis. Turned out I was just really dehydrated. Edit. I now realize I remembered wrong. It wasn't the internet that made me think this. It was those bullshit seminars they had show up at school that try to teach children not to have sex because if you do you'll catch babies and the AIDS and then die. r/Hydra homies would like a word with you. I've had a lot of kidney stones over the last 15 years or so. 2 lithotripsies and past at least another 6. I can't even remember anymore. Depending on the quality of the health insurance I had at the time and the state of my bank account. Sometimes I would seek treatment and other times I'd just tough it out at home with a heating pad. Lots of water and profanity and tears. And whatever pain meds I had, either OTC or prescription left over from the last time. For the last one, a year or so ago, I decided to go to urgent care. The usual doctor there was this good looking but not too bright fella that my friends and I all call Dr. McDreamy. I knew my body and knew my symptoms so I basically just wanted an x-ray to confirm and proof of treatments to cover my butt if I needed time off work. Told the doc my symptoms and he ordered a urine test. I obediently peed in the cup and waited. He came back and told me I had a bad UT. I was like, comma caused by the stone. And he literally rolled his eyes and said I guess we can get an x-ray. After I got my x-ray, he came back to give me the results. He couldn't look me in the eye as he sheepishly told me I had not 1, but 2 stones this time. I called him Dr. McStupid after that. I'm an RN in pediatric neurology. We frequently have families who refuse to put their kids on seizure medications regardless of the EEG findings and the fact that they, you know, have seizures and stuff. One family did the research and attempted to cure the child's epilepsy with essential oils, over-the-counter CBD oil, yoga, metal iron wristbands, to balance the brain. They even went as far as having the kid's dental fillings removed and replaced with a non-metallic filling. There was the time that someone told us she didn't need medication because if you opened a fizzy can of Pepsi and put it under her nose she would come out of a seizure. If that didn't work, you could whisper Reese's Pieces in her ear and she would stop seizing. My least favorite visits are from parents who refuse to believe that their kid is twitching because they have motor tics and likely Tourette's instead of epilepsy. Like, if it was a choice between Tourette's and epilepsy, you should choose Tourette's all day long. Why these parents are hellbent on giving their kids a diagnosis of epilepsy is beyond me. I just don't even know anymore. Why these parents are hellbent on giving their kids a diagnosis of epilepsy is beyond me. I'm thinking there's still a big stigma against Tourette's. While most lay people don't realize how bad epilepsy really is. There really is. My mother has a form of epilepsy and her seizures make her weak for a day or 2. Not to mention if gone unchecked it can have serious impacts on the brain. Tourette's though, which my cousin has, comes in many forms and doesn't harm the person. Learning to cope with tics is much easier and less jarring compared to epilepsy. A mother who was convinced her son had familial Mediterranean fever. He did not. She was repeatedly told this. Nicely of course. Yes, the child had had genetic testing by the time I saw the family. Oh. But a small percentage aren't detected by the testing. Thing is, her kid was fine. Healthy kid. Mom was just obsessed with this diagnosis. Not exactly Munchausen by proxy. She never did anything to him to make him sick. Or subjected him to a lot of unnecessary procedures. But on that spectrum, she was just a really big fan of Mediterranean fevers. Like a couple people have posted, I've been on the opposite side of this. But I think it still fits. Back when I was a teenager I was a really big fan of human comics. And she posted a sigh about a condition she was recently diagnosed with called polycystic ovary syndrome or PCOS and listed the symptoms. Aside from the ones I couldn't account for like fertility problems, I had nearly all of them. The biggest one being I hadn't had my period in over a year. My parents took me to the doctor who immediately booked me for an ultrasound. Turns out I really did have it and my doctor commended me for coming to him about it. I'm very thankful to Human for posting that SAR. I never would have known otherwise that what I was experiencing wasn't normal. Edit. I got out of work just under an hour ago and have taken the time to read all your replies. Holy crap, this blew up. I wish you all the best. On the other side of the fence, I'd asked over 20 doctors if my symptoms might be endometriosis or adenomyosis. Answers were all over the place, including you don't have symptoms at all. What you're describing is normal, 6-month-long periods with crippling pain. Not normal. Your symptoms aren't bad enough to be either. And your symptoms are far too severe to be either. I was sent down rabbit holes. Maybe abnormal vaginal bleeding is a gastrointestinal problem. And given BS diagnosis, you must be depressed. Here's a prescription. Because OB-GYNs are totally the right doctor to diagnose that. Yeah. Turned out it was both endo and adeno. So, periods should be 3-7 days. And should not cause you to be bedridden in pain. And should occur roughly monthly. If this isn't the case, see a doctor. Then keep seeing more until one ducking listens. Endometriosis takes an average of 10 years to get diagnosed in the US. Most doctors have no idea what the symptoms are and will dismiss any complaints as normal period pain. For a stretch towards the end of high school and beginning of college I repeatedly had sinus infections. We're talking one every 3 to 4 months for the span of about 2 years. The nurse I got initially told me not to believe everything I read on the internet and to stop googling my symptoms just for my doctor to come in about 2 minutes later and say, "So you have another sinus infection?" Knowing I was going to be right without her checking. Off topic, but I have a patient right now who has been intubated in the ICU for a couple days after evacuating around 2L of pus and peeling off hardened pus from her lung after trying to treat her pneumonia with healing crystals. Sucks. Has a really wonderful family and group of friends. She's slowly getting better though. So this is why you haven't been putting out new albums. I had the reverse happen. I went into my family doctor of 10 years with an extremely itchy arm with a rash. I work with suck animals and told the doctor I was positive that it was either ringworm or scabies. They told me no. Definitely not, and prescribed hydrocortisone for contact dermatitis. And sent me back to work with the animals. 3 days later, it has the telltale ring of ringworm and is infected due to the hydrocortisone they prescribed. I went back in and asked why I didn't come sooner. I raged. Not only did I start an epidemic at work since ringworm can be passed between species, and the doctor insisted it was simple skin irritation, but I still have an extremely visible scar known as post-inflammatory hyperpigmentation that can take up to 3 years to fade. My doctor said he could fix it with a $300 skin laser treatment. I found a new doctor. My doctor did the same thing and didn't believe me when I told her I was pretty sure I had scabies. She just prescribed some hydrocortisone. It ended up getting so bad I had little clear bumps all over my hands from the parasites. I was completely miserable and ripping off my skin. I went back and she finally took it seriously and I ended up having to use this cream that is basically poison and go through 2 cycles of it to get rid of it all. 3 of my friends also ended up with scabies. Note: don't ever find a couch on the side of the road and put it in the hangout room where everyone goes after school. Got scabies from an old couch we found and put in our fort as kids. Frig scabies. Veterinarian here. This is the worst I ever had. But not because they were wrong. A large lady wearing a muumuu brings a kitten into the clinic. She plops the kitten onto the examination table and says, "Pretty sure it's got ringworm." I examine the kitten. And sure enough, it has a couple of classical ringworm lesions. Too young to give oral antifungals too. So I prescribe a topical therapy for it. Large woman asks if that would work on human skin too. I say it should. She says good. Because the reason she knew the kitten had ringworm was because she found a lesion on her own body that she looked up on Google. And it looked like ringworm. And before I can ask anything further, she flops out one large, saggy and obviously non-brassiere supported tit through the neck of the moo to show me the ringworm lesion on the top of her left boob. Yes. That's a ringworm lesion on your pendulous breast. Now please put it away. Edit. Spelling correction of moo moo. But moo moo seemed appropriate. Moo moo. Appropriate attire for the vet's office. My sister is a paramedic. One day she and a team are sent to house. A man had called about a broken arm. I don't know how he broke his arm the first time, but had read somewhere on the internet that if he just kept breaking his arm then the pain would go away. He had tried around 3 times by jumping up and smashing down his weight on his arm. And it shocked everyone that he proceeded after the first time. In the end the guy had to get 4 surgeries on his arm. But my sister isn't sure if it wasn't eventually amputated or not, since she was pretty sure by the look of it in the x-rays that it would have to be. Jesus Christ. Did they give him a mental health evaluation too? This is somewhat related but I'm not a DR. The only time I self-prescribed was when I thought I had rhabdomyolysis. Never had even heard of it before. I woke up that morning feeling like I'd been in a car accident, had done a very heavy workout 2 days prior, and literally wondered why it was the worst soreness of my life. I didn't start doing any web stuff though until after I went to the bathroom and realized my piss looked like Coca-Cola. What's funny is even going to the I was thinking, this is a total waste of time and I'm going to be laughed at by a DR today for being a dumbass who looks up shit online. Then I spent the next 5 days in the hospital and went through 70 IV bags before I was finally discharged. Yo. 70? Last time I had strep I needed 3 bags in a row and they were acting like that was crazy. 70 bags. My dude. How are you alive? Yeah. It was terrible but kinda hard to argue with your kidneys will shut down if we don't do this coming from my doctor. The worst was at the beginning. There was about a day and a half where they were changing bags every hour and I was pissing at the same rate. There was a pump they used so that it would finish the bag in an hour and I remember there was always this weird cold feeling in my arm every time they changed it. It was interesting to watch my pee slowly change color to normal though. Thanks for watching. Subscribe for 3 videos a day.